residents deserve respect and care in all interactions. In fact, we have a legal obligation to honor the rights of the residents that we serve. State regulations spell out specific rights that each of our residents are to enjoy. They include dignity in all relationships with staff, visitors, and others. Residents have the right to privacy. Privacy when receiving care or assistance, privacy in managing their personal affairs, as well as the right to visit with visitors privately. Residents have the right to safe and comfortable accommodations. This would apply not only to their individual bedroom or apartment, but to the community as a whole. Our residents have the right to receive care and supervision that is personalized to their individual needs and preferences. That care and supervision will be delivered by appropriately trained staff in sufficient numbers to meet the needs of all residents in the community. Of course, residents have the right to choice. They're allowed to choose the services they will receive. They're allowed to make simple choices every day, such as which clothes to wear or what foods to eat. They also have the right to choose their healthcare providers, such as their physician, home health agency, or pharmacy. While we always strive to meet and exceed the expectations of our residents, sometimes things may not go exactly the way they would like, and they have the right to file a formal grievance. Of course, we would encourage residents to let us know if they're ever unhappy about their care or services. They also have the right to file those grievances with the state licensing agency, as well as Adult Protective Services. Residents have the right to refuse care or services. Now, it's important to remember that while they have the right to refuse care, we have a responsibility to ensure their health and safety. If a resident ever refuses needed care or services, you must notify your supervisor, and we will want to speak with their physician or primary care provider about how to resolve this issue. Of course, our residents also have the right to be free from any form of abuse or neglect. While we would never like to think that anyone in our community would harm one of our residents, this is a reality we must be aware of. Abuse could be perpetrated by a staff member, by another resident, or perhaps by a visitor or even a family member. It's important to be aware of the types of abuse that we may encounter. The first is physical abuse. This would include any sort of assault, sexual misconduct, or physical or chemical restraints. Neglect is the failure to provide necessary care or services to a person that we are responsible for, including our residents. Older adults are particularly at risk for financial abuse. It could be a family member or perhaps someone who enters their apartment and takes a check or a credit card. Another type of abuse is isolation. We would never force a resident to stay in their room, for example, or not allow a resident to participate in activities with others. It's not always the most obvious, but we also need to be aware of emotional abuse. This could include threatening a resident or speaking to someone in a belittling manner. Because you work in a senior living community, you are what's called a mandated reporter. This means you have a legal obligation to report any abuse that you witness, that you suspect, or that someone else tells you about. Always follow state procedures for how to report and specific time frames for reporting. You'll learn more about these in training with your supervisor.